Because he's like he was like.
Oh, he's gonna touch it. He's gonna boot the snoot. What are you gonna get?
Probably a breakfast sandwich.
That does sound good.
Yeah. Early girl tomato soup. I have no idea what that is.
Early girl is a type of tomato, so this is a type of tomato sauce.
Oh. Learning. Okay.
Learning.
Are you ready to order?
Yes, we're ready.
Okay.
The best part of the morning. This tastes like life.
This is Dr. Minerva Loi. She's going to school twice. Bless her heart.
Bless my heart.
Why'd you want to go into oral surgery?
I went into dentistry originally because an oral surgeon actually came to my school and talked about it. And I'm talking about trauma, I'm talking about orthognathic surgery. It's just really a cool field. But I didn't decide until I was actually in dental school and I got into the OR and actually saw some people cut some faces up. It was like magic. It was like I was in the OR 1 minute and the next minute I was like, this is me.
Just like didn't fit in very well.
Alright, so you wanted to fix asymmetry.
That was my biggest concern. I think I look great now.
Well, that's good to hear.
So I actually went to another eyelid surgeon a few months before I went to see you, and she was like, no, you know, if you do your eyelids, you'll probably increase your asymmetry elsewhere. Don't do them. But I was still really unhappy with that answer, and I already had you bookmarked. I originally wanted to go to you first.
So why'd you go see her first?
Because she was in San Francisco.
Oh.
The distance.
It's too far to go from San Francisco to San Jose.
I mean, when I didn't have a car, yeah.
Okay. The day you had surgery, someone came in from Ontario, but you're right, San Francisco is pretty far.
You're the plastic surgeon?
I am, yeah.
You are.
Yeah.
Cosmetic surgeon. What do you prefer?
Facial plastics, I guess, because I'm mostly working on the face.
Plastics, interesting.
He was actually my surgeon. He did my eyelids.
I did, actually. That's true.
Interesting. I'd get the eyelids done, I think, if I had anything.
Okay.
Well, she only did it for asymmetry.
Dangling eye.
My eyelid wasn't down here.
Definitely recommend surgery.
Can we talk about this beard?
Oh, right, you're countering my beard. I don't know, man.
In London, the beard's the thing.
This is it?
Yeah.
I should grow a longer one to compensate. I mean, I don't have any hair up here. Can I
Maybe use this, man.
Oh, this muff?
Oh,
Yeah, now we look like twins.
Yeah, I was gonna say.
All right, so you go in for this consult. I'm sorry, what did she say about dealing with the asymmetry?
So she evaluated my eyelids and said, essentially, if I corrected my eyelids, then I would have a new asymmetry from the distance of my fold to my eyebrows, and that might bother me even more. So why risk it? So alternatively, she offered to add some filler to the bridge of my nose to take off the focus on my eyes. Obviously, I fell for it. I didn't like it. I could still see my eyes asymmetry just fine.
You didn't have your nose on your mental radar at all.
I had mentioned that oh, you know, my nose bridge is kind of flat, but it doesn't really bother me. What I'm here for is my eyelids.
What I'm thinking is she heard that and basically just jumped on that as an opportunity to do something on you.
Yeah.
Just steer your attention away from the thing that she essentially wasn't comfortable doing.
Yeah.
I see that a lot in my own industry. You go in for one thing and you leave with something else. I mean, don't get me wrong, actually, a lot of times there's good reason to help a patient take their attention away from something, either because it's not safe to do or it really is not achievable. But if you're not comfortable doing it, you should just tell the patient, that's not my thing.
Essentially, I used $1,200 on something I didn't really want.
That's what that cost?
Yeah, and I still ended up going to this guy and getting my eyelids done and loving the results way more.
I see. Yeah, we don't charge $1,200 for nose filler, by the way. So if you're in San Francisco, it's worth the drive.
Well, I can't tell that. I don't think that you had rhinoplastics. Typically, you can. No. So
you can kind of tell, right?
So you did eye surgery?
Yes.
Was it the lids?
So I had a lid asymmetry. This one was droopy. So he cut both and made them even. And now they're beautiful, in my opinion.
I guess part of today's thing is it's sort of getting rid of some stigmas or Asian eyelid surgery used to be called westernization surgery, which is.
Well, I remember, and that's when I was like, oh my god, no, you didn't. But I was like,
no, she came in one was kind of like this, and the other one was sort of like this, and that was it. And she came in, I'm like, well, you're pretty kind of cute and gorgeous all on your own. And she's like, thanks, but make them even anyways.
She's blushing. Oh my!
Are you?
A little bit, yeah.
It's gone.
So you did the surgery not to make your eyes look different. It was just symmetry.
Yep.
That was it. What was the distraction? Dealing with makeup, or what are we talking about?
It was just like, as I got older, the one that was folded over more just became more and more different from the other one.
I see.
So I think like I had just gotten to a point where the asymmetry was large enough that I felt comfortable moving on with the surgery.
Okay.
My mom actually offered to pay for my surgery when I was like 21 or 22, saying that, oh, you know, your eyes just, if they were a little bigger, it'd be better. And I was like offended that she had offered.
Really?
And then I hit like 27. I was like, oh, yeah, should have taken up that offer.
Dang. I know how you feel. My mom was like, son, you'd be better looking if you were just a little taller and more handsome.
And everything.
And everything.
So surgery wasn't scary at all. You like numbed me up pretty sufficiently, just like with the first couple of pokes, and after that I didn't really feel anything. It was like, what, an hour and a half?
I don't even think it was that much. You were there for about an hour and a half.
No,
I mean,
it was super chill.
I like to think about the things that gives people anxiety when they're having surgery, and I think the biggest is just you're awake and you don't have any control over what's going on, right? I mean, if you think about it, physically it's not that big a surgery. It won't kill you, it won't really hurt you, but you still are just sort of laying there.
Getting your face cut on?
Having your eyelids altered or your nose or whatever it is that somebody's doing, and you're just leaving it 100% up to them. I think as physicians, we just forget about that part. We just reassure patients, oh, you'll be fine, and they will, but in this case, they're awake for that experience. When they're asleep, they might be nervous, but eventually they're asleep and they give up control completely, but they're unconscious and they don't have to deal with it.
I think that's why in oral surgery it's a little easier, because you can offer sedation, and most patients do sedate because it's like the standard of practice. At least that's what patient experiences.
What was the worst part of the recovery for you?
The recovery actually wasn't bad at all. It was just mildly irritating to have swollen eyes.
Well, you weren't super private about it.
I stayed home for like a week.
But I mean, if you saw someone you knew, you're not freaking out.
No.
Yeah, those are the patients who have a really hard time with the recovery period, because if they're trying to hide it from everybody, which is kind of impossible, even a subtle result, someone might notice. Now, the more private the person is, the longer their healing time is. And so for the eyelids, what patients tell me, they look bad, but they don't feel bad.
Everybody I knew or worked with already knew I was going to get the surgery, because I'm just not that private about my life in general. Like, I don't think there's anything wrong with getting my eyelids done. So then I actually took my OMFS portrait photo like 2 or 3 weeks after the surgery. And I can tell that I had the surgery, but nobody else could.
That sounds about right. I had a surgery done during my residency. I got no privacy. Everybody showed up for that, and I was wide awake. It was a vasectomy. First off, the cutest LVN in the building comes in to prep me.
But you're talking about like the iodine swab.
Yeah, she came in to do the iodine swab, which was really cold, and the room was cold already. So it was really cold. It was cold. So cold. Other people tell the story differently, but it was really cold. Trust me.
Get the loupes, extra magnification.
Jesus. It was successful. The loupes worked. I guess they helped. Like I said, it's so cold.
So cold. Couldn't even see him.
Which way am I going next?
Straight.
Alright. Couldn't even see him. It wasn't that cold. Jesus Christ.
Fun time.
That was fun. Thanks for doing that.
Can't wait to see the video. Bye, Laura. Nice to meet you. It was nice meeting you. Bye. No. See you guys.
Your pastry's here.
Oh.
Let's go eat. Driving Laura's car today.